Today, I'm going to talk basically through these 4 groups of things about how you can manage pain, about how you can control swelling, how you can work on maintaining or improving the movement in your hands, and then also about function and grip, which is what you need to be able to play your musical instruments, do your knitting, do your handcrafts and all of those things. So it's really around these 4 topics that I'm going to talk. So starting looking at the causes of pain and swelling, and that's the inflammation that occurs within the joint. So inside the joint there's a lining called synovium, and that's got a lot of blood vessels in it and nerve endings, and that's what becomes inflamed within the joint. Once that cartilage and synovium wears away, that's when we have problems with the bone. So what do we do about that? So we can rest joints and tendons when they're inflamed by supporting the joint, and we use splints to do that. So just like the rugby player wrecks his knee in the tackle and, you know, Richie McCaw jumps up and the whole world falls down because he's got a painful swollen knee, what do? They put it in a splint, they rest it, they do some investigations to say, hey, does that ligament need to be sewn back together again? But basically, the body then gets on and it does its process of managing inflammation and settling that process down. So in terms of pain and swelling, things you can do. So ice, so a hot swollen joint, that's our immediate intervention when something's acutely inflamed. So anything cold. And I don't know about you, but in the hands, you know, the bone is really close to the surface, so plonking ice cubes onto your hand is generally quite an unpleasant experience. So I often say to people, use you know, the wheat bags or rice inside some sort of cotton or material, so any fabric, and you put that ice or wheat or whatever in your fabric bag, an old pillow slip or whatever, and then when it comes out, it will contour to all of your hand without causing sort of burning and hot spots like an ice cube is likely to do. I'm not saying don't use ice. I mean, if you're happy doing that, that's fine. But using cold from your wheat pack is quite effective. So compressing swelling, there's a limit. It needs to be a comfortable level of compression. So when you're supporting a joint, if you wrap it too tightly, it will be painful, more painful. Compression should support it and feel like it eases it. Otherwise, you've got it on too tight. And you can do compression by using things like compression gloves. I'll pass, as I talk about it, I'll pass things around. So these are the Isotona sort of compression gloves. And then there, I'm not sure if people are aware of these ones, the Thermoskin gloves. I personally really like these. I get cold hands, so I use these when I go cycling. Bandaging, most people have some sort of bandage at home, and bandaging in itself, as long as it's applied not too tight, can often, for a period of time, give relief. Skins, I'm not sure, I don't have any here, but these are the super fancy things you see, you know, all the athletes wearing on TV or people running around Orange Parade or whatever. And skins can come in a variety of different ways. They can be, you know, just socks, tights, there's arm sleeves, and in the hand, that compression, Isotona compression one I'm sending around is the beigey coloured one. It's a fingerless glove, so you still have, you can use your tips, but it does support all of the joints. And some people sleep in those at night because it gives, when your hands are resting, do some people find their hands feel stiffest in the morning when they wake up? Yeah, so that helps combat that pulling and the swelling that can occur overnight. And when you're sleeping, you aren't moving your joints, so they tend to be stiffest in the morning. So there's a huge role for gentle exercises when you're managing swelling. Your body reduces swelling or moves fluid passively. We don't have an active system that pumps fluid, like the heart pumps blood, but our oedema or lymphatic system relies on muscle contraction and relaxation to move it. So if you leave something sitting or hanging, you know, most people know what it's like. You've been for a long walk or something, and if your hands are hanging down, they will get a bit of swelling, and that's normal. That's normal. That's not abnormal. It happens to everybody. And how you combat that is what we call the muscle pump. So you must contract and relax muscle in order to move fluid around your body. So rest splints for pain and swelling. So I'm going to talk about, at the moment, the neoprene. So neoprene is like wetsuiting material, so it can get wet. This is one of the commonest ones we use for sore thumbs. So neoprene, if anyone's ever tried to get in and out of a wetsuit, a whole full wetsuit, it's like getting it on and off. And the same thing happens when you place it around a joint with the correct level of compression. Once again, it cannot be too tight because that will cause more swelling and more pain. So this one for the thumb fits around that base joint of the thumb that's often very, very painful and has an extra support strap that comes around to support. So I'm talking about the soft supports here, the neoprene, which are very good for pain and swelling. I'm just going to veer off slightly here because a couple of people raised it and I haven't put it in there. It's just talking about trauma. So what happens is you can have a degenerative or wearing out of a joint occurring in your body, which is the normal process that happens to all of us as we age, and that can be completely asymptomatic. Like you have no problems whatsoever in that joint till you trip and fall on your hand or slip and land on your hip or whatever, which a number of people have alluded to. And what happens is, because as your joint wears and you have less cartilage and your synovium isn't as fresh as it once was years ago, your joint has less absorbency, if you like. It doesn't absorb impact as well, and so you tend to get much more bone on bone impact. And so it means that the ability of a joint to absorb overload and pressure is diminished. And in that situation, it's chicken and egg, isn't it? You had a joint that wasn't as good as it used to be, but it was functioning perfectly fine before you fell. But the trauma then escalates up that whole process that was happening at a mild level. And suddenly you end up with someone who presents with this huge swollen hand that they cannot move. And of course, we always say, well, the person fell, we have to refer you for a check x-ray. And then the x-ray says, oh, there's degenerative changes in the joint. And then, yes, AC say, well, we're not going to pay for that because that was there anyway. So when we're talking about swelling, the hand is very special in that we have so many tendons in the hand. I feel like I'm blocking your view, sorry. And that people can get referred pain down through the thumb and fingers because the synovium that lines joints also lines the tendon sheaths that the tendons run through. So tendons, just as a reminder, are the connection between, if you've got muscles in your forearm, both sides, on the back of your hand, the ones that straighten, and on this side, the ones that bend. So the tendons are the strings, if you like, that go from the muscle down through and attach into the bone. And it's contraction of the muscle and the pulling on those strings that allows you to flex and extend your fingers without having bulky muscle in your hand, because that would detract from the dexterity of your hand. Now, because the synovium lines those tubes, if you have inflammation in your synovium, the whole inside of those tubes can become inflamed. And that means it's incredibly stiff to bend and straighten your fingers, and it's not coming from the joints, it's coming from the inflammation in the tendon sheaths. And sometimes when it gets so bad, it can trigger and lock. Has anyone had triggering and locking? Yeah. And so when you get that, and this often happens to people, you know, young, fit people who are mountain biking. I've got a mountain biker at the moment, and his little finger has just started completely locking down into his palm, and he can't straighten it out because of the inflammation in the tendon sheath. And so in that situation, we would use a rigid splint, like one of these rigid plastic ones that are coming around, more like these, depending on which joint is affected. And we would rest that joint, and we'd rest that joint 24 hours a day for 4 to 6 weeks. That's how long it takes to settle down that sort of acute inflammation. We're not talking about wearing something for a couple of hours and going, oh, well, that didn't work. We're talking extended periods of time to settle inflammation. And in that situation, you mentioned steroids. And when you've got problems through your flexor sheaths, particularly with bending, they will quite often consider the steroid injections. We need tendon gliding exercises. So I call this Tai Chi for fingers. So this, if you go home and learning nothing else today, remember about the Tai Chi for fingers, because this is really important. This little sequence will put all of the joints of your fingers and your tendons through full range of motion. So you're starting with your hand extended, yeah? So it's going from this side across. So hand extended, and then you're tucking in so that your fingers are bent in, but this part, the back of your hand, stays straight. Do you understand what I mean? Yeah? And then from that position, from that hook position here, and we call it a hook because it's sort of the hook grip you use when you're picking up a bucket handle or something. And then you fold in. From that position, you just relax down and your fingers drop into your palm. And then you flick your tips out. So that position really helps with those tip joints. Yeah? Does that kind of make sense? And do this, and this is where people often get confused, with the least possible effort. Not the most. It's not about squeezing really, really hard. It's like Tai Chi. It's a gentle flowing. So you're trying to get this flow in your fingers. Yeah? And if you get confused about the sequencing, it doesn't matter, as long as you assume those 4 positions. Yeah? Sound okay?
How often should you do that?
That's an excellent question, and we'll talk about that right now, because it's a balancing act that you have to work out for yourself, okay? And everybody's tolerance and ability is very different, very much dependent on how inflamed your tissue is. So you want to balance. If you rest too much, then you will just be stiff, and you'll never be able to address that. If you do too much activity, then you're gonna get too much pain. And what is that balance point? I can't tell you, because you feel it. It's something you feel, it's what you live with, not me. Yeah? But what you're wanting to try and achieve from your exercise is getting your joints through full range of motion at least 10 times a day. So, There's two different sorts of exercises. So there are flexibility exercises. So that tendon gliding that we went through, it's all, and with no effort, that's all about flexibility. And so that's maintaining motion. The other sort of exercise we do is about stability. And that's trying to strengthen a particular muscle that supports a particular joint. So think of this as the difference between when you're exercising, aerobic exercise where people are running, and stability exercises where people are doing weightlifting. So one's strengthening muscle and one's creating motion. And we have to be quite specific. And so if you, for instance, the idea of squeezing a tennis ball, that doesn't give you full motion in the hand, it blocks you. And in squeezing a tennis ball, all you're working are your big forearm flexor muscles, and you're really not working and stabilising any of the good little muscles in the hand that really help give us intrinsic stability in the hand. So, this, I think, if you want one stability exercise for hand, this is it, because most people lack good thumb stability. And this is where we're getting that thumb and index finger together, and you're making a big C. So you want the gap between here and here, so here and here, to be the biggest it possibly can. So not like a duck, you know, didn't we all do this as kids? Yeah, so not like that. It's got to be as wide as it possibly can across here. Because when you do that, you're activating this muscle here. You know, this one right under here. And you can feel that difference when you come out into that position, that you will get that muscle firing. So the way you're doing this is getting into this position, is using least possible energy, and then trying to hold it, making sure this joint here doesn't collapse in. Now, all of your hands are going to be in different stages and positions. And arthritis in the hand affects all of you differently. So I can tell you this is a great exercise for most people. But it may be very difficult for some or one of you to do. So what we're trying to do is make sure we're working that muscle in here, in the base of the thumb.